Good afternoon, everyone, and welcome to today's webinar, Getting from the Data Sharing Land of No onto Pathways to Yes, Navigating Data Sharing Projects for Non-Attorneys, brought to you by the Network for Public Health Law. I'm Sadia Mohammed, the Marketing and Communications Associate at the Network for Public Health Law's National Office, and I'll be your host for today's webinar. Just a quick note that both the presentation slides and the video playback for this webinar will be available on the network's website shortly after the conclusion of today's event. Please feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the Ask drop-down menu, and submit your questions. Your presenters for today's webinar are Chris Alibrandi O'Connor, Deputy Director at the Network's Mid-States Region Office, and Stephen Murphy, Senior Attorney also at the Network's Mid-States Region Office. Chris focuses on legal issues related to the collection, maintenance, use, and storage of data for public health purposes. She also provides legal technical assistance and training related to legal issues around data, using plain English to relay often complex concepts and break down the inaccessibility of legal information. Stephen joined the Network for Public Health Law as a senior attorney focusing on public health data access and data sharing. He worked as an attorney for the Chicago Department of Public Health, concentrating on public health data privacy and public health law. Stephen will be leading us through the rest of today's webinar. So Stephen, over to you.
Thanks very much, Sadia, and good afternoon and good morning to everybody, depending on where you are. As Sadia mentioned, I'm Stephen Murphy, and so I'm going to be kicking us off here, but I am joined by my colleague, Chris Alibrandi O'Connor. We will be talking today about a structured approach to data sharing. And before we do that, let me just go through a couple of intro slides just to let you know who the network is. We are funded by the Robert Wood Johnson Foundation, and we provide technical assistance and resources and consultation and training to public health officials at local, state, and federal public health agencies. And in addition, I want to just mention DASH, which is Data Across Sectors for Health, which collaborated with the network in order to produce the resource that we will be talking about today. DASH is led by the Illinois Public Health Institute in partnership with the Michigan Public Health Institute, and they also are supported by the Robert Wood Johnson Foundation. And they support alignment among healthcare, thanks, Chris, and public health and other sectors to systematically compile, share, and use data. Next slide, please, Chris. Thank you. All right. So Chris and I will be talking about our structured approach to data sharing today. And our presentation today is based on a new resource which the network is launching, which is the Pathways to Yes document. That document was a product of a collaboration between the network and DASH. And it focuses on a structured approach to data sharing. So a approach that you can use from one data sharing to the next. And there were several authors involved with that particular resource. And so what the resource does is draw from the experiences of those authors to lay out what would be involved in a successful data sharing project so that that could be replicated over time. So it is something of a roadmap for a successful data sharing project. Although I do want to say, just with the fine print, that while Chris and I are attorneys, we are not your attorneys, and so anything that we provide today should not be considered legal advice. And for legal advice, we encourage you to consult your attorneys. And then just lastly, on this screen, you'll see a link on the bottom of the screen there to the resource that we will be talking about today. That link there is networkforphl.org/pathways to yes. And so that resource and the webinar today will track one for one. We'll be going through the steps that are outlined in that particular resource. Next slide, please, Chris. Okay, so we do want to invite folks to, I think Sadia mentioned already, to please feel free to enter comments in the chat and to ask questions as you want to ask questions of the presenters. We'll try to get to your questions. In the meantime, let's start with a polling question here to try to get a gauge on who we have today. And so this particular polling question is, are you or will you soon be working on a data sharing project? And you can see that the answers there range from I am not working on a data sharing project and don't have plans to, or I am currently working on a data sharing project, or I will be working on a data sharing project in the future. So please enter your answers in now, and we'll give you a moment to do that. So just waiting for folks to have a chance to enter in their answers, and then once folks have entered into their answers, hopefully we'll see the results and we can share them with folks. All right, so it looks like it is a mix of folks who are currently working on a data sharing project and folks that are planning on working on a data sharing project in the near future. And so it looks like you guys are in the right place. So with that, we'll go to the next slide, and I'm going to pass the baton to my colleague, Chris.
Okay, thanks, Stephen. And thank you, Sadia. And with all hope, I'll be saying thank you to my dog too, because she just started barking. And I'm hoping I have enough treats to keep her quiet for my next 5 minutes. Apologies if she barks. So the reason why Pathways CS was created was there was a problem. And in terms of defining the problem, what we kept hearing from organizations that were seeking our legal consultation on data sharing that they were trying to do was that they often kept running up against what we and others have termed the culture of no. You know, people are hoping to share data. They often get deep into their project and then they hit this, you know, so-called culture of no. So that was one of the problems that Pathways CS was, you know, developed to address, but also people just didn't have a user-friendly guide to data sharing. And that was the other impetus for our creating the Pathways to Yes. Now, Stephen and I actually have already run a 4-part series of webinar, like an online, you know, class that we taught that goes into much greater detail than what we're going to do today, a 4-part series on the Pathways to Yes materials. And we in terms of getting confirmation of this culture for no problem, we had this group of people that were made up of representatives from government agencies, from nonprofits, from educational institutions, community organizations. They were the members of our 4-part group. And we asked people where they encountered the culture of no, if they did. And we often heard from people where they hit it was when the project got to the desk of the attorneys. So we asked them to describe their interactions, which is not the only place that you can hit the culture of no, but that we have confirmed is largely where people hit it. And we asked them to describe their interactions with attorneys on their data sharing projects in 3 words or less. And what we encountered was somewhat predictable for us as lawyers, because we know we're trained as lawyers to be risk averse and to avoid liability for our clients. People found that their lawyers were very conservative in their approach, or they had, one person even actually heard in response to, can we do this data sharing? The attorney's response was basically no. Just my saying no is easier than doing the very complex, you know, work that may be involved, if it's even possible to get the data sharing to happen. So we mention this because it is confirmation of maybe some of the experience that you've had, but also because we also stand as good examples of lawyers who have pushed through the culture of no. And hopefully you can get to the point with your attorney relationship where you see some of the other words that are there, where people found their relationships, or they describe their attorneys as being passionate, vital, and valuable, brilliant. So that's where we're hoping you can get to in your process also. There are also, I won't take too much time to go into it, but affinity group members also, you know, mentioned barriers to developing a data flow map. And that's something we're going to talk about next, actually. So there are 5 steps that were developed as part of the Pathways to Yes framework, which, as Stephen already described, is a legal framework for data sharing. And as I read each of just the title of the 5 steps, I want you to think about which of these have prevented stumbling blocks for your data sharing efforts. So the first step is to review your relationships, internal and external. The second step is to develop a use case for your data project, your data sharing project. The third step is to develop a data use map or a data flow map. The fourth step is to conduct the legal analysis of the sharing that has to go on in there. And the fifth is to establish the terms of the sharing and represent or document them in a data sharing agreement. So another quick polling question here. Of those 5 steps that I just mentioned, and I recognize that you may not have absorbed all of that, if you could identify which of those steps has been the most challenging for you, or is the most challenging for you if you're currently involved in data sharing. There's no right or wrong answer to this. Just pick the one that, you know, resounds most clearly or most loudly for you as where you have encountered challenges. And we'll just take a second for that and then we'll move on. And so far, the dog is staying quiet. Thank you, Jesus.
That's good news. That's okay. I may have a cat that jumps up on the desk in a moment, so we'll have a, I don't know, competition with the pets.
So Sadia will decide when to pull the trigger on the second poll here. Okay. All right, so the clear winner is conducting the legal analysis in terms of being the area that the most people have had, the greatest number of people have had challenges, followed by the data sharing agreement, establishing the terms of sharing. Okay, well, that's helpful. That's really helpful to know. All right, thank you. All right, so let's go on to the next slide. So the Pathways to Yes resource actually includes 5 case studies. One of them is on housing and health. Another one is on opioid misuse prevention. A third one is the one that you see in front of you here. So they are attached at the end of the Pathways to Yes resource, and we definitely encourage you to use them. So they follow each of the 5 steps that I was just talking about, and they provide examples of how the Pathways to Yes steps give a framework for planning a data sharing project. So we chose this case study, the fall prevention intervention case study, to weave through today's presentation so that you can see Pathways to Yes in action. So I just sit back and listen for a second, unless you prefer to read it yourself, but I'm just going to read it so you'd have it fresh in your mind, because you'll be hearing about examples of this as we go through the presentation. So here's the case study. Every year, older adults in the project city suffer over 4,000 serious falls that require a visit to the emergency room or an inpatient hospitalization. These falls frequently lead to death, disability, or loss of independence. This project is aimed at reducing the number of falls in the project city that require those inpatient hospitalizations or emergency department care by 1/3 over the next 3 years. The purpose and the use of the data will be to identify problem locations where the falls occur and contribute to a disproportionately high number of falls, to investigate the reason for the falls, and to immediately use the information to advise community partners on where to locate interventions, like home health aides, for example. So the state's Health Information Exchange, the state's HIE, is serving as the project's exchange, serving the project city is the data source. So the data is all going to be found in the HIE. The HIE serves as the hub of the project by collecting identifiable hospital emergency department data based on ICD-10 or 11 codes. The HIE curates, summarizes, and visualizes the data in a dashboard and makes that available to the local health department. So the core data elements to this project are that they're going to be seeking to get from the HIE are the date of the fall, the location of the fall, the emergency room or the emergency department admission date, the age of the patient, and the patient's health outcome. So with that, now having that in the back of your head, I'm going to turn it back over to Stephen to talk about step 1.
Thanks, Chris. Okay, so as Chris mentioned, we have 5 steps here that we're going to cover, and I'm going to start out on the first one here, which is to review your relationships. You can go to the next slide, please, Chris. And so as we think about a data sharing project, if you think about it, we have data going from A to B, and it might be going unidirectional, where it's going from A to B. It might be going bidirectional, back and forth, or it might be multi-directional. And so you're going to have different partners involved in the data sharing, if nothing else, even just with where the data starts and where the data ends. And so we think about the relationships involved in a data sharing project, and we can kind of parse them out into 2 categories: internal relationships and external relationships. So let's start with the external ones for a moment. So really, the external relationships really are the basis for your data sharing initiative. The external may be the source of the data, they may be where the data is going, and all of this is built on trust. If you think about a data sharing project, really in sharing data with another party, you are entrusting the data to them, and you are trusting that they will treat the data in a way that you expect it to be treated, that they will safeguard the data in a way that you expect it to be safeguarded, and that they will treat the data in compliance with the law and any contractual obligations. So maybe if you have a data use agreement, you will expect that the data will be used in compliance with those terms. And so as you think about those external partnerships, then they can further be broken out into those existing relationships and then building on new relationships. So in terms of those existing relationships, it really will be more efficient and give your data sharing project a better chance of success by harnessing those existing relationships. And that may lead to more progress more quickly, and may also lead to a more efficient data sharing project. But it is also then important to focus on new relationships. You may find that there are new sources of data to be gained from new relationships, and that may take time. It may take time to build those relationships and to foster those, and it may not be possible to share data with those folks at the beginning, but it nevertheless may be an important step. And then another piece of the relationships is community engagement, which also has a very positive impact on data sharing projects and a positive impact on health outcomes. And so assembling those partners may help you then get your data sharing project off to a successful start. It may also help you define the problem that you want to be solved with the data sharing initiative, and to help define what that solution will be, or what the outcome of the data sharing will be. And so then we can also think about the internal relationships. And really there, in terms of a data sharing project, it's important to think about who are those folks that will be at the table, or that should be at the table at the beginning of a successful data sharing project. And so in your experience, you may already have gone through this process, but at that table at the beginning of a data sharing project, you may have a program person, a program manager, a program director, or sometimes referred to as a business owner. You may have information security folks at the table. You may have IT folks at the table, privacy folks at the table, maybe legal counsel at the table. You may have project management, you may have informatics, you may have other folks at the table, you may have somebody from leadership. All of these folks are important to get your data sharing project off to a successful start, and to make sure that you don't go off in a direction that actually is not tenable and that you have to then backtrack. So it's important to have those right people at the table from the outset. And then next slide, please, Chris. I want to just spend a minute talking about project champions, because this is a concept that I have seen used successfully. It is helpful to have a project champion on your data sharing initiative at the table. And the project champion really is somebody from, not from the top of the organization typically, but from middle to upper management. And that is somebody that then can add some clout to your project and can obtain additional resources if you need to obtain additional resources for your project. And they can help also communicate the benefits of the project to upper leadership, so that you have support from upper leadership as well. And it is important to have the right people at the table. The project champion can also be helpful in bringing everybody together for your data sharing project. I've experienced projects in the past where it was difficult to get people to come to the table, difficult to get people's availability. Sometimes having a project champion, somebody who is perhaps from a more senior role within the organization, can help bring the correct people to the table in order to give your data sharing project the best chance of success. Next slide, please, Chris. So another role that's important to have involved in your data sharing project at the outset is the attorney. And Chris and I are both attorneys, and so we have experienced this firsthand about the issues that are involved with a data sharing project and why it's important to have your attorney involved in a data sharing project at the outset. And that is because it really gives your project the best chance of success if you have legal counsel involved at the beginning. Often with a data sharing project, as many of you know, I'm sure already, you will run into issues relating to whether or not you can share the data, whether or not you can release the data, whether or not you can use the data. And so it's important to have an attorney involved at the beginning of your data sharing project so that at the outset, you can get off on the right foot and that you don't make assumptions about data sharing that turn out to be not feasible. Perhaps, you take off with lots of energy and your data sharing project gets going, and then further down the road, you consult with an attorney only to find that, in fact, the attorney has grave concerns about sharing the particular types of data that you may be looking at. And if you think in the public health context, as I'm sure many of you know already, there are many categories of data which have very heightened protections, things like HIV and STI and mental health and substance use. It can be very tricky to work with that kind of data and to share that kind of data. And so it's important to have your attorney involved at the outset. And another point I want to make here is that Chris and I also both recognize that, we receive training, as all attorneys do, to chiefly be very risk averse. And so that is something that we also try to overcome. And it's something that we try to address in these steps and in the Pathways to Yes as well, about trying to work with your attorney to get past perhaps the answer of no and to get to a place where you can actually share the data. And so one of the strategies for that is to really do your homework before you go to the attorney to talk about your project. And so to bring to your attorney the homework so that you have explored who are the partners, what is the data, what are the data elements, what's the purpose of the sharing, what is the outcome that you hope to achieve, what are the types of risks that you foresee from your data sharing project. It's very important to bring all that to your attorney. And then in addition, one of the pieces that we recommend also is that one approach to eliciting the help of your attorney is to not so much ask, can we do this, but to bring that homework and to explain the project and really kind of get the attorney on board with what you plan to do, rather than kind of have this kind of gatekeeper role of like yes or no. It's helpful to work hand in hand with your attorney. So let's go to the next slide, please, Chris. So Chris mentioned at the outset that we cover certain case studies in the Pathways to Yes, and today we're going to focus on one particular case study as we go through each of these steps. And so Chris described this case study already. This is the one that involves identifying falls so that we can prevent falls in a given jurisdiction. And in terms of identifying the partners, this particular case study is helpful because it involves a lot of partners. As you can see on the screen here, there was the local health department and the state health information exchange. There were other entities involved, including the housing authority and public schools and nursing and pharmacy. So this is a good example of where you have a lot of partners involved in a particular data sharing project. And that in itself can add a lot of benefit to your project. It can really give your project a good chance of succeeding if you have that many partners involved who can combine resources and offer solutions and overcome barriers. Next slide, please, Chris. And so in this particular case study, the fall prevention case study, this is also a good illustration where the collaborators in this particular case study determined that they would focus on the health information exchange as the data hub. And that was because they recognized that the health information exchange already had the infrastructure in place around things like privacy and security and that they had systems in place to collect data and to process the data and to analyze the data, and that also that they were very used to complying with different laws, state and federal privacy and security laws. And so that was why they chose the health information exchange. So we'll return to this particular case study as we go through the rest of the steps. Next slide, please, Chris. And so with that, I am going to pass the baton to Chris to talk about our next step. Chris, you're on mute.
That's to avoid the dog whining in the background. Okay, so the next step is developing a use case. And the use case is basically the guide to your project, because developing it prompts you to think through all the major decisions that you need to make in order to avoid surprises once you're deep into the project. So under the Pathways to Yes material, this section talks about understanding what a use case is, how to articulate, your own use case, and then identifying its essential elements or the essential elements of a use case. So use case modeling. Okay, what is a use case? How is it useful? So the use case modeling typically begins with the identification of two different things. One is the role of the key stakeholders in the project, like Stephen was just talking about, and then also the objectives for the project. And it's considered good practice to develop a use case in order to clarify and communicate often the very complex work that's going to be done by these collaborative partners. So as I said, the use case is a written guide for the project. It helps you identify and resolve important project issues like who's going to be involved with this, what data is actually going to be shared, how is the data going to be used. These are all key questions that you got to get straight on at the beginning. It helps simplify the project development process. I think of it as basically by having a guide for you, it keeps you from spinning out or going into circles, especially when you get into questions that you don't immediately have answers for. So it gives you a structure, right? The goal is to contain all the necessary information that you need to communicate the value of the project. So think of it as this is what you can give potentially to funders, right, to get support for the project, or what you need to share possibly with your, the internal folks that you want to become your project champion, right? It articulates the whole case and the value of the project for you. And then it also helps to develop the legal analysis of the data sharing activity that you're proposing in order to identify what the laws that are relevant to the sharing might be or will be, and then also to resolve any legal issues that come up, or at least ones that are identified at the outset of developing the use case in the project. Okay, so there are 7 basic building blocks of a use case. I'm just going to review this at a real high level. You put in there, what is the objective of the data sharing? What do you and your partners want to actually do together? What information do you need to share, to access, to use, to disclose? Where is the data going to come from? What will you need to make this happen? How will the data be transmitted and stored? I mean, there are some key security issues that need to be thought through at the very beginning. And then often, once you get done with thinking through your use case, it's then a good time to kind of go back and revisit who are the partners to this project, because they may have grown or shrunk in the process of thinking through the use case. So one thing is specifically I want to mention too, is that the data use case helps, or give us some examples of how it helps identify issues. So in the use case that we're talking about, the fall prevention use case, when I was thinking through how would the use case fit that scenario or that intervention, one of the things I thought about was, okay, how is the data about where the fall happened captured in the hospital record, right? You can only grab data that actually is being captured already in your, in this case, the HIE, right? Or originally in the emergency room, the emergency department's electronic health record. So you need to figure out, for example, okay, one of the data fields that we wanted in this use case is the location of where the fall happened. So is that data actually being collected in the emergency department's EHR? Is it being collected in an actual data field, or is it being collected in free text? Because if it's being collected in free text, that's different, and it's a different process you've got to go through, and it's more laborious than just being able to pull it right from a data field. So how do you address it if it's in free text? Or another question is, how long will this agreement exist? Is it needed just for the time, just to share the past 3 years of data? You're just doing a grab from the systems, get the last 3 years of data to inform your future actions. Or is there some desire to continue, like an ongoing effort to collect the data periodically? So these are the kind of questions that might pop up, again, as you're thinking through what your use case is or developing it. Now, I have to say, because while we are big proponents of being able to share data, we are also big proponents of the privacy rights that come along with that and the consent that's needed to share what is often our very personal data, because we're all consumers, no matter what other roles we play. So we wanted to point out that, health information privacy laws are really designed to balance two things: our personal privacy interest in our own data with the public good or the public's need for information. Generally, we often think of it in the context of public health, right? Like, in the example of COVID, obviously there was public need to have information about where cases were spiking, how they were being transmitted. And in those cases, that outweighed the personal privacy interest because there was this bigger public issue going on, right? So reasonable people can and do disagree on where the balance should be struck. And the balance often changes over time, right? Based on societal opinions, around privacy or, critical public health issues too, like the one I just gave as an example. Okay, so here is just a very simple, idea of what the project use case could look like for, 1 second, Kiba, here. Another treat to the dog. So what the project use case, how you would articulate at least the problem and the purpose in this example, the fall prevention example. So articulating again is what helps you clarify. So in this case, it would be the problem is older adults' falls often lead to death, disability, and loss of independence. In addition to the people directly impacted, medical resources and limited home health services are being stretched thin by what could be avoidable falls. So that is the problem statement. The purpose of the goal of the project would be to identify problem locations that contribute to a disproportionately high number of falls of older adults, to investigate the reasons for the falls, and to immediately use the information to advise community partners on where to locate interventions to reduce the number of falls by 1/3 over 3 years. So that's just giving you a quick example of a down and dirty what this would actually look like. And then additional features within the data, within the use case are identifying who the partners are, what are the data sources, what are the data elements. So in this case, the partners would not just be those who are sharing data, which would be the public health department and the ER department, but it would also be the Council of Elder Services and the home health services, right? And that'll be a little different when we talk about the data sharing agreement, because fewer partners are probably involved in the data sharing than in the project overall, or at least potentially that's the case. And the data sources, this is where you need to get very specific: hospital admission and ER data for visits with the specific ICD-10 or 11 codes for the past 3 years to be transmitted via state HIE. So again, clearly thinking through what are the data elements that you need help you to realize, okay, are we going to have trouble getting it because it's not a data field already, it's in free text, for example. And then laying out what your data elements are. So, and then the last, again, with the use case is legal issues, identifying that. So again, in this case, it would be due to the protected nature of medical data. Analysis is needed for the applicability of HIPAA and state privacy laws, and what legal agreements need to be in place for the proposed data sharing to occur. Again, it's documenting it to give you that roadmap forward. Okay, so now we have another polling question. Stephen, can you do this one for a second, and then I'll be right back?
Absolutely, yeah.
Thank you.
Okay, so this is our third polling question, and here we're asking what types of individuals' data you want to share or do you currently share. And so this is a multiple choice question, but you can enter as many answers as you want. And so the answers choices are behavioral health data or health data, not including behavioral health data, or social service data, and then also government agency program data. There might be a little bit of overlap in there, or other type of data. So really the types of data that you want to share or that you're currently sharing. So we'll take a minute just for folks to enter their answers and see what we come up with. And incidentally, while folks are entering their answers, I will remind folks just to enter any questions that you may have in the chat. And also just, if you want to just let us know if this stuff is resonating with you, if the first two steps that we've covered have resonated with you, or if there are questions that you have, feel free to put those in the chat and we'll be happy to address those as well. So we'll just give folks another moment to enter their answers. All right. So this looks like a bit of a smorgasbord, to be honest. It looks like half of folks are engaged or would like to share behavioral health data. A full 81% say that they are working or plan to work with health data. And then also there's a pretty good showing as well for social service program data and government agency program data as well. So this is really helpful info. I mean, it seems like folks are working on many different types of data sharing projects from the looks of things. So with that, Chris, do you want to pick it up here, or shall I continue on with the?
It's on to you anyway.
It's on to me anyway. Okay, great. All right. Well, so so far we've covered looking at your partnerships and then developing a use case. And again, if you want to enter comments in the chat or if you have questions about those, feel free to do that. We're going to move on with creating a data flow map. Chris, could you go to the next slide, please? And so a data flow map. So folks on this call probably have seen some data flow maps over time. I'm not sure how many folks have developed one themselves, but again, feel free to enter that into the chat if you wish. But really what we're talking about in terms of a data flow map is really a diagrammatic representation. That's a lot of big words, but really just a picture of the data flows, showing where the data is starting and where it's ending and where it is going along the way. Data flow map should identify the data flows, and so there should be direction to it, showing which is the direction of the data. And it should show many of the details, like where the data is created, where it's stored, where it's processed, where it's shared, and where the data is destroyed, if that's included on the flow chart as well. So really looking at the life cycle of the data. And then it may also look as well at the different technologies that are involved in the data flow process that you are working with. And it is used by different stakeholders that are involved in the data sharing project. It is very helpful to the information security folks, for example, in determining what information security controls need to be applied to the data. It's also very helpful to the legal analysis, and Chris and I have both used data flow maps to conduct our legal analysis around data sharing to identify the most appropriate legal strategies. The data flow map can help us visualize where the data is going, who's touching it, and so all of that brings up some legal questions around what can and what cannot be done with the data. Next slide, please, Chris. And we'll look at some examples of data flow maps in just a second. But I just want to highlight again, it is an opportunity to identify every point at which people and systems interact with the data. And also it should show where the data is being transported. And really, like these these intersections between people and the data and the systems will have legal consequences. And so that is important as well for the purposes of conducting a legal analysis. And then, as I mentioned, it is also important as well to information security. So let's move on to the next slide, Chris, if you wouldn't mind. So here we're just going to look at an example of a rather simplified data flow map. And you can see here that there are two streams of data. You'll see on the left-hand side that there is a patient encounter. You have a patient at the top here on the top left-hand side. They have an encounter with a healthcare provider. And so data is then entered into a health record, the healthcare provider's electronic health record or electronic medical record, or even a paper record, but we'll stick with electronic. And so that makes its way into the health record, and then some of the data from the health record then, in this example, makes its way into the state's cancer registry. So there may very well likely be a law that requires the healthcare provider to report certain information into the cancer registry. So let's look at the right-hand side of the data flow map, and you'll see that there's a different stream of data here where we start with an employee and there is an occupational exposure, so some kind of workplace safety event, and that results in the employer then entering information into a record. And so they're entering information from this occupational exposure into an employment and environmental record. And then in this particular example, that information is reported to the state's occupational safety agency. And so then towards the bottom of this screen, then you'll see that this all is put together because there is a public health analyst that is working with the data. And you'll see that data from the employer side then has made its way into the university research database. And so the public health analyst is pulling that data into the database. And then you'll see in this particular example, there is an interaction between the cancer registry and the university's research database. And you'll see that there's two flows of data here. There is identifiable data that is going from the university research database to the cancer registry. And then you'll see a symbol on here about the linking tool. So there's a linking tool that's involved here, and that is connecting data from the cancer registry with data from the research database. And then the last data flow that you'll see here is the de-identified combined data that's going from the cancer registry back to the research database. Now, as long-winded as that might have been, you can imagine that without the data flow map, that would have been even more confusing. So the data flow map helps us kind of visualize all of this so that we can put it together in our minds as to exactly what's happening with the data. Next slide, please, Chris. So just going back to our example of the fall case study. And again, this is one where we are looking at a large number of falls in a particular city and trying to prevent those falls by working with the data. And here you'll see a very simplified data flow map illustrating the data flows that are involved in that particular project. And so the data starts up on the top left-hand corner there with the emergency room. So there's patient encounters in the emergency room, and that produces some data which is then communicated to the state health information exchange. And so that's identifiable data, data that can be linked to individuals that's going to the state health IE. And then in this particular project, then there's de-identified data making its way to the local health department through the state health information exchange. And from there, then there is an additional output of data then from the local health department to the community stakeholders. So the community stakeholders then are other partners that are involved in this particular project. So you can see a rather simplified data flow here that reflects the case study. If you can go to the next slide, Chris, I just wanted to briefly share a more complicated example. And this was pulled from the CDC website, just to give you kind of a flavor of what these look like in real life. They tend to be more complicated. This particular example here, as I say, is from CDC, and it shows the flow of data within a suite of publicly available software programs. And you can see that there are bundles of raw electronic cancer abstracts that are processed, and they're processed through this certain software, which is listed in the middle, and that prepares data for importing and storage in a central database. This is actually just half of this particular data flow map. There's another half to it that better or, that kind of bills it out a little bit further. But this just gives you an idea. You can see in here that there's different symbols that are used. You can see that there's different types of boxes that are used for the data sources and the data outputs. And then you can see the lines with direction, and those are coded as well for output, input, and traffic between different apps. So just an example of this is kind of what they look like in real life, and they can get even more complicated. A data flow map will typically illustrate, the linkages and like whether the data is encrypted, and a lot of other details as well. So next slide, please, Chris. And so for this one, I'm actually going to pass the baton to Chris to introduce the next polling question.
Sure. And the other thing I thought to mention too also is that in one of the data flow maps that Steve was talking about, and he was identifying some of the data is identifiable and some of the data is de-identified. And part of the relevance for that is that different laws may apply, or the laws may apply differently, I should say, to whether the data is identifiable or not. So that's a helpful piece of information to have on a data flow map. Okay, so think about a data flow map for your data sharing effort. And we recognize you may not have ever crafted a data flow map before. So, put on your thinking hat and think about where in this process, even if you haven't actually done a data flow map before, where have you had successes already? And go ahead and check off all that apply for you. So have you had success establishing the interfaces that are needed to share the data? Have you already identified a clearinghouse or a storage location that wasn't, a challenge for you, or it's been successful? One of the toughest nuts to crack often is whether or not you need consent from the people whose data it is. And have you already figured out how to obtain that if it's a circumstance where you need that consent? And I would love to talk with anybody who checks that answer off after the webinar, because that's been a tough nut for a lot of people to crack, or the other two examples there. So go ahead and take a second to check off all of these that apply where you've had successes in your data sharing. Success broadly defined, and then we'll go from there. Sadia, you can call it whenever you see enough responses. Okay. All right. So this is good. We've seen folks, some people have had, half the folks have had success getting the interfaces or the connectivity. That's great. Or identifying what your clearinghouse, your data clearinghouse is going to be. That's great. So fewer folks, about a third of folks have done the consent issue about how to obtain the consent or authorization. All right, this is interesting. This is really good to know. And the data governance is about a third of you also have had that experience. Okay, great. Thank you, Sadia. Now we'll keep on back to Stephen for the fourth step.
Thanks, Chris. Yep, so we move into the fourth step here, and we're talking about conducting legal analysis. Next slide, please, Chris. So here we're talking really about the role of the attorney in conducting.
You want to go out? Come on.
Chris, you are not muted, actually.
Oh, sorry.
But we were talking about conducting the legal analysis, but then also how you can best approach your attorney, presuming that you do have an attorney. And I do recognize that not everybody on the call has access to an attorney. It's a luxury for many folks. But if you do have access to an attorney, then how you can best approach the attorney and how you can best prepare your work to bring it to the attorney. So obviously the legal analysis is going to be a very important step in a data sharing project. And nevertheless, the homework part, though, is also very important, which was why we covered the use case and the data flow maps before this point, because it is helpful to have those pieces in place in order to conduct the legal analysis. And so the attorney is going to be looking really at the big picture with the data sharing project. They're going to be looking at the different data involved and the data elements specifically that are involved, and they're going to look at the data sources from where that data comes, and then also, very importantly, the purpose for which the data will be used or for which it will be shared. And that is something that also should be very clearly defined. And in my experience, it's not always at first clearly defined, but in order to analyze a data sharing legal question, you really have to know what it is that the data is going to be shared for. Because if you think, for example, just about a HIPAA example, and a HIPAA does not apply to all data, and it's certainly not the dispositive question in all data questions, but HIPAA includes a requirement to get consent from individuals, but it also then includes exceptions to that with permitted uses and disclosures that are permitted without the need for the individual to approve or object. And that will all depend on what are those permitted uses and does that apply here. And so, with a data sharing project, identifying that purpose, whether it is, this purpose, this particular data sharing is going to be for research, and this is what the contours of the research are going to look like, this is what the research goals are going to look like, that's going to matter, because in the context of HIPAA, for example, then that will mean that you will have to take steps that are outlined in HIPAA in order to share data for research. And so you'll have to go through an institutional review board, et cetera, et cetera. So the purpose is very, very important. And so knowing then what the contours of the data sharing project look like, the attorney then is going to do a landscape analysis of what laws could apply to the data and to this particular purpose. And from that, then they're going to try to determine whether or not the data sharing is permissible in this specific instance. And sometimes that answer is straightforward, and perhaps you're looking at a data sharing project that's relatively simple and you're going to be sharing de-identified data and the legal analysis is very short and sweet. Most often it's not short and sweet, and it does require a lot of detail and a lot of working through problems. And so one of the things that we talk about in the pathways to yes is kind of finding that pathway to yes. Because sometimes your initial legal analysis will determine that this is actually not permitted, or that there are legal barriers to the sharing or the use of the data. And so in a minute, we'll look at what are some of those strategies to overcome barriers when you do your legal analysis, or your attorney does the legal analysis and they determine that actually, I don't think this is going to work because whatever, you're trying to use mental health data, and there are very, very limited uses on mental health data under the state's mental health code, or, you're trying to use HIV surveillance data. And again, there are very limited uses on what you can do with HIV surveillance data. So we'll talk about some of those strategies in just a moment. But even if you do the legal analysis, or your attorney does the legal analysis and they determine that, yes, this is permitted, the law nevertheless is going to have some requirements around what can be done with the data, and some prerequisites perhaps, and limitations on what can be done with the data. And so the attorney's role then is also to figure out what those conditions are and how to put those in place. And so if, for example, there are limitations on what can be done with the data, that may need to be spelled out, for example, in a data use agreement or a memorandum of understanding or something. And so that's part of the attorney's role as well. Let's go to the next slide, please, Chris. And so in conducting that legal analysis, I do appreciate this particular webinar is geared towards non-attorneys. So I'm not going to go into this in too much detail, but some of those questions that the attorney will be dealing with are things like, dealing with laws that are on the federal level, state level, and local level, and they may be consistent and they may not be consistent. And so some of the issues that come up then is things like preemption, which is a concept where federal law will typically or may preempt state law depending on the facts, but there may be federal preemption that will basically control, and the state law that conflicts with it will not control. And that's not always the case. That preemption is a area of law that has to be analyzed in every given case. But then there's some other concepts as well, excuse me, when you have different laws and even different provisions within the same law. I mean, I worked in looking at laws around different public health data in the past many, many times, and pored over, one particular law that will have many provisions and trying to figure out if this particular data sharing is permitted in this instance. And you may find, as I have found, that you have a provision that is that seems to suggest that's permitted, and then a paragraph later, another provision that suggests that it's not permitted. And you have to work through those inconsistencies. And typically what happens when you do have provisions where some are more restrictive than others, you go with the more restrictive. That's kind of a tenet of law around data. And then similarly, you may have laws that are specific and some that are general. And even within the same law, you may have some provisions that are very specific and some that are very general. And so typically, the more specific will control in that scenario. That can be problematic as well. Again, when you're looking through a law and one part seems to suggest that you can share the data, and then another part that would seem to suggest that maybe you cannot because one is very specific and one is general, and so you have to work through that. And then obviously all of these analyses have to be made by your attorney. And so hopefully with the background that you get from this webinar, you'll be a little you'll have a little bit of a leg up in helping talk through some of these issues with your attorney. Next slide, please, Chris. So let's see. So one of the things I talked about just a second ago was kind of finding this pathway to yes. So if your legal analysis that your attorney conducts initially turns out that this is not going to work, because perhaps you're trying to share data that is very restricted. So maybe you're trying to work with HIV data and it's surveillance data, let's say, and there's very heightened privacy protections around HIV data for very good reasons. And so you may encounter a situation where you cannot use that data. And so what do you do in that case? Well, you can give up on your data sharing project, or you can try to work through some of these alternative strategies. And the first one here is finding similar data. So you may find that, for example, that a specific data that you're trying to access has restrictions around it because of who holds the data. And it may be the case, however, that that same data or similar data is available from somebody else, from perhaps it's available through a federal government data website, or perhaps it's available through another state agency. Each specific data analysis will be different. And so who holds the data and what the data is specifically will change. So it may be a case that you can find similar data. And then the consent piece as well is also very important. It sometimes works that you can obtain consents from individuals to access and share or use their data. It's not always the case. It does get very tricky when you have large amounts of people. However, if you think about the FERPA context, for example, that's the federal law that governs educational rights and privacy around student records. That law is very restrictive, but it does permit obtaining consents in order to share someone's data. And so that's an example where, although your initial analysis may turn out that you cannot share the data, perhaps you can obtain consents through even like a kind of a structured process of obtaining consents from parents in the educational context. And then the next example here is using de-identified data. It may be the case that you can, instead of using identifiable data, you can use de-identified data. That's not always the case, but sometimes it may work. And then the next example here is restructuring your relationships. And so this is just kind of thinking through these different permitted disclosures and uses. And so if you think, again, just about the HIPAA context, because I think it's a good, it's a helpful law to use for illustration purposes because it is very detailed in parts and it does permit many different types of uses and disclosures of data, while it's also very strict around what can be done with the data. But it does permit, for example, disclosures and uses for research, but it also permits disclosures to something called a business associate, which is where you have somebody using the data on your behalf in order to do something that they are doing on your behalf, and they need identifiable data for it. So it may be a case that you start out thinking that your project is going to be about research, but you go through an IRB process and the IRB determines that it's not research because it doesn't fit the definition of research. that may be an opportunity to think about, well, maybe this is something else. Maybe this relationship is actually more of a business associate relationship. Maybe this is like somebody else doing services on our behalf for which we need to give them access. That obviously has legal implications, but that's just another way of looking at alternatives. And then the next example that you see here is to redefine your overall approach. And so I'm going to try to move through these last two examples pretty quickly, but the redefining your overall approach, that is another example where, perhaps your legal analysis is based around using substance use data, and the substance use confidentiality provisions that you're looking at do not permit you to share it for public health. You may have to look at a different approach then to see, is it permitted some other way? And then the last example that you see here, to modify your organization structure. This one's a little trickier, and the example really is around HIPAA and hybrid entities, which are a particular type of covered entity. Just making that kind of structural change is a very big structural change, but that can sometimes help with data sharing projects because it'll free up part of your organization. We could talk about that one in a lot more detail, but we don't really have time to right now. Let's go to the next slide, please, Chris. So these are just some examples just to show you when we do kind of that landscape analysis of what kind of laws might apply to particular data. There are many, and it's not just a case of like, does HIPAA apply? There's many different laws that can apply around things like medical records laws or surveillance laws, or even things like identity theft or consumer rights laws. All of those things will play into a data legal analysis. Next slide, please, Chris. And then just looking at our case study again, this is our fall case study. You'll see here that the legal analysis in that particular case study involved analysis around de-identification, and the HIPAA was really what was used there around de-identification because it includes some standards to follow if you are de-identifying information. So taking information and taking out elements out of the data to make sure that the individuals could not be identified from the data. But there are other considerations as well around things like medical records, privacy laws that have to be considered in the context of the fall prevention analysis as well. Next slide, please. Okay, I will pass it over to you, Chris.
Okay, great. So talk a little bit now about agreements for data sharing. Which is the fifth step in the process, because you need to document, what the agreements are going to be about. So when we're talking about agreements for sharing in the Pathways to Yes materials, there are three kind of bigger issues that we address or talk about. One is establishing and documenting the agreements for the data sharing, because you need to have some kind of written documentation of it. Also, we talk about, basically understanding what a data sharing agreement is, what a data use agreement is, and what a memorandum of understanding is. And then also identifying the elements that makes a DSA or a DUA a legally enforceable vehicle or document. So the functions of an agreement to share data. So the idea of it is basically that you want to capture the understanding of whatever it is that the two or more parties or people that are, or what they're agreeing to do, or in some cases, what they're agreeing not to do. Like, are they making, for example, are you making hula hoops? How many? What colors? By when? What happens if the hula hoops don't turn out round, for example? And the process of drafting the agreement for the data sharing is how you get to consensus to establish and document the terms of it. The nitty-gritty is what you need to hammer out, and that gets done certainly at this stage, the data sharing agreement, if it hasn't already been done before. Like, for example, some common terms that you might think about in terms of data sharing is what level of security and privacy of the data is required by law and or of the parties. So those are just like a couple of examples. So the functions of the agreement to share data are to describe the relationships between the parties, to define the project's purpose and the goals, and how the data sharing actually supports the same. Stephen and I have actually been involved in some legal work where The terms were not clear enough, so we had to actually go back and look at the purpose in the purpose section of the agreement to be able to add clarity where the terms were not specific enough. So that's, one reason for that there. The agreement should clearly state the legal authority for the data sharing, outline the terms that are agreed upon by the parties, identify the data elements to be shared. As I had said before, you can't be kind of willy-nilly about that. You have to really pin it down and be specific so that there is no there isn't lack of clarity later when your IT people are involved and they're talking about how to share it. It's very clearly delineated earlier in the agreement. And then provide monitoring and accountability methods for compliance with the various laws. So there are more than 2 agreement types in the case of data sharing, but the ones that we specifically focus on here are a data sharing agreement or a data use agreement and a memorandum of understanding. And there may be others like there could be, depending on what the relationship is of the various parties, it could be like under HIPAA, a business associate agreement too, but we're not going to go into details about that. One thing we specifically want to say is that, no 2 data sharing agreements are exactly alike. It's very hard to create a generalized template for them. You think about like Mad Libs. It would be lovely if we could create like a Mad Lib of a data sharing agreement where you just plug in the pieces that you need. But invariably, there could be whole categories missing because of the unique nature of the data sharing you're doing. And we always joke around about if you've seen one data sharing agreement, you've seen one data sharing agreement. Now, the differences between a data sharing agreement and a memorandum of understanding is that an MOU is a non-binding agreement between 2 or more parties that, yes, it outlines the terms and the scope and the details of the mutual understanding, noting everyone's responsibilities and priorities or responsibilities and roles and all of that. But it's generally a tool that's used by government agencies where the parties are not seeking a legal commitment to each other, but rather they're just trying to come up with an agreement on principle. And that's because MOUs are not legally enforceable. So there has to be a great deal of trust between the parties to, go ahead with the MOU, but frequently having an MOU instead of a data sharing agreement avoids what could be a very lengthy contract review process, and therefore sometimes it's easier just to execute an MOU as opposed to a DSA, as long as the MOU meets the needs of the work that you're trying to do. So here is, I just kind of roughly drafted out what a data sharing agreement, certain elements of a data sharing agreement might look like in the case of our fall prevention study. So don't take this as like cut and paste and it's now your DSA template. This is really just an example. So, and it reflects the thinking that was first documented in the use case that we talked about earlier. So again, here we are at the parties to the data sharing agreement are the public health department and the Memorial Hospital emergency room department, as well as the state HIE. Now, note that in the use case, there were additional partners like the Council on Elder Affairs, and then also the home health services, the local home health services, but they're not actually going to be technically sharing the data. So that's why they're not partners to the data sharing agreement. And then we've got the purpose listed here, which looks similar to what the data use case was. Clearly, there's an opinion coming from the living room. Okay, so then also the data to be provided. So again, the data sharing agreement, very specific. Look, it should resonate with what we talked about for the data use case, or the use case, I should say. So the data to be provided is all entries of Memorial Hospital's ER visits or hospital admissions that had those ICD codes, the specific ones, and all the ones that are listed there are the ones that refer to falls that happen in a house, falls that happen, when transferring from a bed to another piece of furniture, whatever. So it's, different categories of them. Yeah, so let's go to the next slide. So, and again, another couple of terms here are the privacy and security requirements. Very important in a data sharing agreement that there be explicit understanding of what standards will be applied for that. And then also the period of agreement, again, it's important to have that documented so that there's a known end date. Maybe you've got language in there about if you want to extend it, you can decide that. Okay, so going over that rather quickly, but there you have it. I mean, those are the 5 steps. To recap, it's reviewing your relationships, developing the use case, developing a data flow map, conducting the legal analysis, and then establishing the terms of sharing. And again, there's the link there, which maybe Sadia can throw that in the chat again for anybody who missed it the first time, of what will get you to the Pathways to Yes resource itself. And before we go to question and answer, because it looks like we will have some time for that, we want to give you a heads up. We're going to be doing another webinar 2 weeks from today and this one is actually the same Pathways to Yes material, but presented in a different way because it's geared towards lawyers that are involved in advising on data sharing efforts. And, again, we will be emphasizing different material, but also since we recognize that, some of our colleagues at the bar, as they say, may not have a lot of legal experience with data sharing, the context that you're trying to share data. I mean, for example, they could be like a government attorney who is responsible for 3 or 4 different, governmental agencies, and they've got to know all the law in all their different areas. They may just not have placed, had the reason or the time to put into understanding some of the laws around data sharing. So we'll be really focusing and pitching our explanation to attorneys, and also, think about some of the information that Stephen talked about earlier. We encourage you to involve, if you're not an attorney, to involve your attorney early in the process, to get them involved so that they feel a piece of the process, and also so that you don't find out later in the game of legal issues that had you known about them earlier, you might have altered the course you were going through. We'll be sharing that same information with attorneys and encouraging them from their perspective on how it would be beneficial for them to get involved sooner. So on that note, so that, as I said, there's the information right there. You can also get information about the webinar and register for it, either through that link or back at our website too. And with that, we officially are done, and let's switch over to questions and answers. And Stephen, let me clue you in on, I've been watching the Q&A as you've been talking, and we've had a really interesting number of questions about, I don't know if you can access it, but tribal data. So I let folks know that we actually already do work supporting tribal epidemiology centers with their data sharing efforts, and certainly encourage people to contact us and talk to us offline about more, targeted or more specific data sharing issues, or doing more education for tribal data sharing, or tribes having access to data, or doing more data sharing work with state or local public health departments. Those are pretty much the only questions that I answered through the Q&A. I pretty much left everything else as an answer live. You can go ahead and jump in.
Sure. There's some great questions in here, really good questions that clearly illustrate that folks are knee deep in this stuff. So I appreciate folks contributing. There's a question here from Marielena that is about local health departments sharing data with hospital systems, or maybe it's the other way around actually. But the question is, can you speak to data sharing agreements between local health departments and hospital systems? We want to codify some of the data sharing that occurred during the COVID pandemic. But during the state of emergency, local health department commissioners and hospital CEOs were communicating constantly and just told their staff to share. And now that the emergency orders have been rescinded, how do we continue to get data from health systems that are beneficial to community or population health? So I can take a go at that one, Chris, and feel free to jump in. But I think this raises some really interesting issues, and this issue of what was okay during the pandemic now is under more scrutiny, and perhaps people are were more liberal when it came to sharing data during the pandemic. And not that the pandemic is over, but now that we are further along in it, that perhaps people are getting more conservative again. And so this question asks about what can we speak to data sharing agreements? I would actually encourage folks on the call to kind of think beyond the data sharing agreement. One of the things that I find as a privacy attorney is that I think sometimes people want a data sharing agreement as the solution to problems. And I think, as Chris just talked about, the data sharing agreement really is kind of documenting terms and conditions. It's not the vehicle that grants permission to share data, even though we like to think of it that way. And so, with any data sharing going from A to B, or any other permutation, B to A to B, C, D, whatever, the data sharing has to be legally permissible in the first place. And so I think that's where folks need to think, obviously going through the steps that we outlined today, including things like developing a use case where you look at the different types of data that you want to share, the purpose for sharing the data, and the other elements of a use case that Chris outlined. And then thinking, once you have your clear purpose in mind and the objective and the outcomes that you want to achieve, thinking about, okay, how do we obtain this type of data for this particular purpose? And obviously getting the assistance from counsel will help to think about, how this data sharing might be permitted. In the context of local health departments and a hospital system, you may be looking at HIPAA to address, getting data from a hospital system to the local health department. And so your attorney can help you work through that. Like, what are the avenues within HIPAA that could accommodate that, or other laws that might apply? You might think as well about the kind of authority that your local health department has and how that might be exercised. Perhaps, if you really need something in law that's not there, could you perhaps pass an ordinance or some other law? Is there rulemaking authority perhaps that your local health department might have that could possibly put something into a rule that would facilitate the data sharing? I would encourage you really just to kind of think outside the box if you are getting to that no, and thinking about some of the steps that we talked about today. So there's a long-winded answer, but I don't know, Chris, if you have any thoughts on that.
No. Not that I can add. I was thinking two other things at the same time. So there's another question. This is from Taylor Pinsett. Hi, Taylor. Asking what, and I'm just jumping around here, Stephen, if you want to focus on one of the other questions. I don't know enough about IRBs. There's one that touches on that. That's more up your alley. So Taylor's question is, what are your thoughts on having an overarching data flow map for routine health data sharing versus just for one specific data sharing project? What have you found are some pros and cons? Could this guidance document support an agency-wide approach to sharing? So, yeah, I mean, I definitely think there's value. You can certainly have a broader, data flow for generally how your, department or office, I guess, as you're saying, routine health data sharing. If that, I mean, there's value in it, I guess, if it helps to have a visual of it, if it helps to clarify where the data is coming and going for bigger purposes. I think it's probably less useful to have a bigger one like that that's general than the utility of having one for a specific data sharing project, mostly because if you have a lot of data coming in and out of an entity, there could be a lot of different laws that apply, and there could be a lot of different standards that you've got to think about. So it could end up looking like, if you remember those old Family Circle cartoons that showed a kid walking home from school and it's like up and down and around the bend and over it. So it could end up being so busy that it's not particularly useful. But I mean, that would just be my own sense of it, that the greater utility is for a specific data sharing project, which has concrete terms. Stephen, did you want to speak to that or go to another question? Or
yeah, I mean, I agree with your answer for sure. I think I'm thinking in my mind about like the different uses of a data flow map and how, for a particular data sharing project, as an attorney, I would want to see one that is specific to the project. But then you do have these routine data sharing that go on as well. And there are times when you interact with like information security around like the kind of security controls that have to be in place. They may want to see something that's more kind of departmental or something around like routine data sharing. to ensure that kind of the everyday sharing that goes on, it has the appropriate controls in place. But otherwise, I agree with everything you just said. There is that IRB question that you mentioned, Chris, which I would be happy to jump into. Susan notes that we are in the early stages of migrating a successful pilot under an institutional review board and involving HIPAA protected data migrating to the existing health information exchange to serve as integrator with social service data. Beyond HIPAA related agreements, is there specific guidance in addressing consent and data use agreements between health and social service partners? HIPAA enables sharing for treatment purposes. What if community-based organizations are reluctant to share social care data due to its sensitivity, for instance, with non-citizen populations? Great question. There's a lot to that. I'm going to attack the last piece first, I think, because that seems to be where the biggest question is, but feel free, Susan, to correct me if there's other pieces of this that you want to address more specifically. And so you mentioned CBOs that are reluctant to share social care data due to its sensitivity, for instance, with non-citizen populations. Yes, so certainly there often are concerns around privacy and around things like immigration status. And so there may be some resistance for many reasons to sharing data. I will say that it can, as I think as a baseline, I will just say it can be very difficult to get organizations to share data with you if they don't want to. And we often work through, privacy law questions around what can be shared and whatnot. But, I guess at the end of the day, unless you have a law that specifically mandates the disclosure, then you just kind of have to try to work with your partners to share the data. And if they don't want to, it can be very tricky. The consent and the DOA stuff. So with the DOA, again, I'll just kind of highlight that, we should think of, or I would encourage folks to think of data use agreements as really kind of the icing on the cake. Like once you've done your legal analysis, once you've determined that the data sharing is permissible, then what limitations and terms and conditions need to be put into the data use agreement. But I would encourage folks to kind of get out of the mind frame that the data use agreement is the way of getting the data. Because I think often that's where we trip up and we get stuck. And the consent issue, I'm not sure what the question is specifically around consent, but obviously consent is, and actually Chris can probably speak to this better than I can, but in terms of strategies to obtain data, if you're obtaining the consent of the individuals, then that can create that can facilitate the data sharing. Obtaining that consent can be a little trickier. Chris, I know you've done some work on consent.
Yeah. So I would say, I sure I can. I would say, as far as whether there's specific guidance on addressing consent, it's hard to know like in what context specifically, but so probably the easiest thing for me to say is a position we certainly always advocate is that consent needs to always be informed consent, right? I can't really speak to the specifics that you're thinking of, so I'll go with that, which is, when I go to the doctor's office and they put the notice of privacy practices in front of me, or they don't even put it in front of me, they have it stuck on the mirror, and then they give me something like a tablet just to sign my name saying that I got it or that I consent to share my data or whatever. I mean, that's not informed. I, as a lawyer, it's not even informed, right? So you imagine someone who isn't steeped in privacy law, not necessarily understanding what kind of consent they're giving. So while we don't have, I can't point to any specific guidance on addressing consent. I would certainly encourage people to look into more that where consent is necessary, that you make sure that the partners that are at that the position where the individual who's private information is going to be shared ultimately, that they really are making sure that the consent that's being obtained is informed, that the person is clearly, that it is explained to them what the purposes or the potential uses for their data, how it might be shared. Happy to talk to you, Susan, offline if you want to talk more specifically in ways that I couldn't really address. And Stephen, I think looking at the time, it is now 2:25. So we wanted to wrap up with a few minutes. I'm sorry that we didn't get to all the questions, but we did want to wrap up with a little time for Sadia to put the evaluation in the chat for you, so that you can, oh, and there it is right now, I see it, so that you can give us feedback on this. We, we've done this presentation a few times now. It's always helpful for us to get feedback, to figure out where we hit it, hit the nail on the head and where we could have provided more information. We'll certainly look at the questions and figure out if there are ways that we can bake in a little more information that's responsive to the questions in the presentation. Stephen, anything you want to say or add?
Yeah, I just also note that we didn't get to all the questions, but I do want to let folks know that Chris and I are always available, and we do provide technical assistance if you need it. And so if you do want to follow up with us with a question, please do, and we will do our best to help you with it.